I'm not drawing things. Okay, so I'm going to do all of them. Because you get to draw between certain things. I'm going to do all of them so you see all of them. Okay? Alright. So I'm going to start with your head, honey. I'm who I am, and you are who you are, and I wash my hands. Okay. And so I'm going to start with her head, and I'm just going to palpate to make sure you have any pain or tenderness. And I'm going to look through her scalp to make sure that she doesn't have any friends along with her today. and to tell us about her skin condition as well. Okay, and she looks good. Oh my gosh, I get to touch you just everywhere. I know, are you having fun? Mm-hmm. Are you? Okay, and now I'm going to look at her face. I'm going to put some pressure here. Do you have any pain or tenderness? And any pain or tenderness here? Okay. All right. So now I'm going to move to her eyes. And I want you to look straight ahead at me. And I'm going to do pupillary response to light and accommodation. And if I could, I would turn the light off. And I'm going to look at both of her eyes. Okay, and I'm going to look far away, and then look at my pen. Okay, so that was pupillary response to light and accommodation. Now I'm going to ask you to cover one eye. We can use this fancy little cover if you'd like. And I want you at 14 inches to read the lowest line you can.
Here?
Mm-hmm.
426739.
Very good. Now if you'll change eyes, and I'd like you to read that line backwards for me.
937624.
Okay, she's got good vision. All right. Now, if you can continue to use that cover an eye. Okay, and I'm going to bring in, for confrontation, visual fields. So tell me when you see my fingers in your peripheral vision looking straight ahead.
See it. See it. See it.
Okay, cover the other eye. And do it again.
See it. See it. See it.
Okay, very good. Thank you. Do the cover test. And then the position test, I want you to follow my finger with your eyes, keeping your head straight. Well, you have some strabismus.
Mm-hmm.
Oh, you knew that?
Mm-hmm.
Okay.
Had an old softball injury.
Okay. And then I'm going to just feel for her lacrimal duct. Close your eye. I'm going to feel for her orbit. Make sure everything's okay. There's no pain or tenderness? Mm-hmm. Okay. So now I'm going to move to her ears. First thing I'll do actually is just look at them. Any pain or tenderness? Like, no pain or tenderness? Okay. It doesn't matter. You're not supposed to. What's the only thing that's supposed to go in your ear?
That thing.
Okay, so I'm going to take a look in her ear.
How do you pull the ear, guys?
Up, out, and back. Okay. Did you have a lot of ear infections as a kid?
Nope. Swimmers.
Okay. That ear looks nice and clear, and I'm seeing her cone of light at about 5 o'clock. And I see this one at 7 o'clock. This one looks better than the other ear. Okay. And then I can perform the Rhine test, the Weber test, or the Whisper test. And so I'm going to strike this. Tell me if you hear it equally in both ears.
Mm-hmm.
Yes, this one. So I could do that test, or I could do the other test. Tell me as you hear it go away. Do you hear it now?
Mm-hmm.
Okay, and then I do that on both sides. Or I can get behind her and say,
Coca-Cola. Whiskey.
Put them together.
yeah. Okay. Whiskey Coke. Okay. So our ears are good. Okay, now
That's what
we'll
we
move down
used
to
to
your
know.
nose.
A different
And before you
generation now.
test your sinuses, can you occlude one nose and take a deep breath in and out? Well, not that big. Okay. And then do the other one. Come on, you're cutting into my time. I only got 30 seconds.
30 minutes.
Yeah. Okay, and then I'm gonna take a look up, just kind of lift it forward, and I'm gonna look up her nose. Okay, and I'm looking to make sure that she doesn't have any polyps or perforated septum or deviated septum. It looks good.
I'm so nervous.
Okay, and we move it on. Okay, and so then I move down, I'm looking at her lips. Put my gloves on. There's one thing I forgot. It was a piece of gauze. But we didn't have it in there.
There's a cotton ball.
No, that's like what we want.
You want to grab my tongue?
Here's some gauze.
I do
Where?
want that.
Use.
Oh, good. Thank you. One clean off for not having my supplies. Okay. Anyway, let's move
I
on.
guess you just go in
What
now.
I'd like you to do is show your teeth. Okay, and I'm just looking at her teeth and her gums. Open up wide for me. I'm looking at her buccal mucosa. Can you lift your tongue up to the top there? Looking underneath her tongue. Okay, we put it back down. Looking at her hard and her soft palate. Okay. Oh God, are you gonna throw up on me? Okay. Open up your mouth. Kind of lean forward a little bit like that. That prevents some food. Okay, and I'm gonna look at her palate and say ah. Okay, and I'm looking at her. Okay, good. Her posterior pharyngeal wall, her tonsils. That's good. Okay, I'm gonna take the gauze.